Welcome to the City of Austin Benefits video. The 2021 benefits information, including the 2021 benefits guide, can be found online at austintexas.gov/benefits. For 2021, the city offers 3 medical plans. Please review all 3 options to find the plan that is right for you. The first plan is the CDHP with a health savings account. This is a high-deductible health plan with lower premiums than a traditional health plan. The PPO is a traditional health plan with copays, coinsurance, and deductibles. And the HMO is a traditional health plan that requires a primary care physician for services and referrals to be covered, and there is no out-of-network coverage except for emergencies. Each of these plans will be discussed in further detail. Let's start with the CDHP with HSA. This plan encourages wise choices in the use of healthcare services and has lower premiums than the HMO and PPO plans. With the CDHP with HSA, you have access to in-network and out-of-network services. You can use any doctor, clinic, hospital, or healthcare facility, but you save money when you use in-network providers and facilities. The CDHP has a health savings account as part of this plan. The HSA is a bank account in your name that you can use to pay for eligible medical, dental, prescription, and vision expenses. The city contributes money to your health savings account on an annual basis. The city will contribute the funds as follows. For full-time employees, $500 for employee-only coverage and $1,000 for employee independence coverage. For part-time employees working 20 to 29 hours, $250 for employee-only coverage and $500 for employee independence coverage. Employees hired after July 1st will receive half of the yearly contribution. You can also contribute money from your paycheck to your HSA each pay period in addition to the city's contribution amount. This account is a valuable tool that helps you save for future medical needs while lowering your taxable income and the amount you pay for taxes each period. You can change the amount you contribute from your paycheck throughout the year. With employee-only coverage, you can contribute up to $129 per pay period, and with employee-independent coverage, up to $258 per pay period. The HSA funds you and the city contribute roll over year to year, therefore you will not lose any money that is not used, so when you retire or leave the city, you keep all the money in your HSA account. You cannot enroll in a healthcare FSA if you have the CDHP with HSA plan. To be eligible to participate in the HSA, you must meet all of the requirements determined by the IRS. If you do not meet the following requirements, you may enroll in the CDHP plan, but are not eligible for the HSA account or the employer contribution. First, you or your enrolled dependents cannot be claimed on another person's tax return. You cannot be enrolled in any other plan other than a high-deductible plan. This includes Medicare, Medicaid, and Childcare. You or your enrolled dependents cannot be enrolled in a healthcare FSA. You must provide a physical address to HSA Bank. An account is not able to be opened with a P.O. box. And finally, you must be a legal resident of the United States. You will receive a debit card from HSA Bank to access the pre-tax funds in your account. When it comes to paying for services, here are some of the basic costs. Preventive care, such as routine physicals, well checks, mammograms, and colonoscopies, are covered 100% in-network. The annual deductible for the CDHP for employee-only coverage is $1,500, and for employee independence, it is $3,000. After you reach the deductible, the plan pays 80% when a Tier 1 provider is utilized, or 70% with an in-network provider for eligible covered services and facilities. A Tier 1 provider is designated as providing higher quality of care and cost efficiency. To find a Tier 1 provider, visit bcbstx.com/COA and then utilize the Find a Doctor tool. The annual out-of-pocket maximum is $5,000 for employee-only coverage and $6,850 for employee independence. The family out-of-pocket maximum is significantly lower than the PPO or HMO out-of-pocket maximum. This means during a health crisis, the maximum amount your family will spend on eligible medical expenses in a calendar year is less than the PPO or HMO. Here is an example of how paying for services works with the CDHP with HSA plan. Jennifer is enrolled in the CDHP with HSA Employee Independence Coverage. By enrolling in the CDHP with HSA instead of the HMO, Jennifer saved $2,406 in premiums. Jennifer's son is sick, and she takes him to the doctor. The cost of the visit after the contracted discount is $100, and she uses her health savings account debit card to pay for the office visit. Her out-of-pocket cost is $0 because she uses $100 of the $1,000 the city contributed to her HSA. This was their only medical expense, and her HSA balance of $900 will roll over to the next year. When you reach the out-of-pocket maximum, which includes the deductible and coinsurance, the plan pays 100% of covered services for the remainder of the calendar year. Now let's talk about the PPO plan. With the PPO plan, you have access to in-network and out-of-network services. You can use any doctor, clinic, hospital, or healthcare facility, but you save money when you use Tier 1 or in-network providers and facilities. You have some coverage if you need to go out-of-network. Choose what's best for you. Just remember that out-of-network providers will likely charge you more. Out-of-network providers can even bill you for the amounts over what your plan will cover. When it comes to paying for services, here are some of the basic costs. Preventive care such as routine physicals, well checkups, mammograms, and colonoscopies are covered 100% in the network. Office visits to your primary care physician will be $10 if a Tier 1 provider is utilized, or $25 for a network provider. Office visits to a specialist will be $25 if a Tier 1 provider is utilized, or $45 for a network provider. Emergency room services are covered at a $200 copay. For major diagnostic services, including MRI, CT, and PET scans, there is a $100 copay. Minor lab, X-ray, and preventive services are covered at 100% with no copay. The annual deductible for the PPO plan will be $500 for individuals. The deductible for this plan only applies to outpatient surgery, hospital admission, ambulance services, or durable medical equipment. After you reach the deductible, for eligible covered services and facilities, the plan pays 80% when a Tier 1 provider is utilized, or 70% with an in-network provider. For hospital admission, if you use an in-network provider instead of a Tier 1 provider, a $250 copay will apply in addition to the deductible and coinsurance. The individual annual out-of-pocket maximum is $4,000. The out-of-pocket maximum includes deductible, coinsurance, and copays. The family out-of-pocket maximum is $12,700. Next, let's discuss the HMO plan. The HMO plan will require you to select a primary care physician for yourself and each of your covered dependents. You will need a referral from your selected primary care physician to access other services such as specialists, except for urgent or emergency care. If you have not selected a PCP, one will be designated for you after 30 days. To change your PCP throughout the year, call the number on the back of your medical card. The change will go into effect the first day of the following month. The HMO plan has a service area requirement. You must receive services in the following counties: Bastrop, Blanco, Burnett, Caldwell, Hayes, Travis, and Williamson. When it comes to paying for services, here are some of the basic costs. Preventive care such as routine physicals, well checkups, mammograms, and colonoscopies are covered 100% in-network. Office visits to your primary care physician will be $10 if a Tier 1 provider is utilized, or $25 for a network provider. Office visits to a specialist will be $35 if a Tier 1 provider is utilized, or $55 for a network provider. For emergency room services, there is a $250 copay. For major diagnostic services, including MRI, CT, and PET scans, there is a $150 copay. Minor lab, X-ray, and preventive services are covered at 100% with no copay. Outpatient surgery will be $750 if a Tier 1 provider is utilized, or $1,000 for a network provider. Inpatient hospitalization will be $1,500 if a Tier 1 provider is utilized, or $2,500 for a network provider. Services are available at in-network providers only, except in emergency situations. There is no deductible for individuals or families on this plan. Quest and CPL are in-network for the HMO plan. You should always verify that the lab you're utilizing is in-network prior to receiving services. For employee-only coverage, the out-of-pocket maximum is $4,500. For employee-independent coverage, the maximum is $8,000. The out-of-pocket maximum includes copays and coinsurance. Each of the medical plans offered includes prescription drug coverage. The prescription drug list is the list of prescriptions that are covered by the plan and organized by cost tiers. To know if a prescription is covered, you can check the prescription drug list. You can find these lists at austintexas.gov/benefits. Choosing medications in the lower tiers saves you money. Tier 1 medications typically include generic drugs. Tier 2 medications are preferred brand name drugs, and Tier 3 medications are non-preferred brand name drugs. Affordable Care Act mandated prescriptions for preventive medications are covered at 100% under all medical plans. For the CDHP plan, that means the prescriptions on this list are paid at 100% even if you have not met your deductible. For the CDHP with HSA, there is also a preventive drug list. There is no deductible and the plan pays 80%. There is also a basic drug list. You must meet your deductible before the plan pays 80%. For the PPO, there is a $10 copay for Tier 1 medications. Tier 2 medications will have a $30 copay, or 20% of the cost with a $60 maximum. Tier 3 medications will have a $50 copay, or 20% of the cost with a $100 maximum. A $50 deductible applies to Tier 2 and Tier 3 prescription drugs per covered person per year. You can continue to get a 90-day supply through mail order for only 2 copays. For the HMO, there is a $10 copay for Tier 1 medications. Tier 2 medications will have a $35 copay, or 20% of the cost with a $70 maximum. Tier 3 medications will have a $55 copay, or 20% of the cost with a $110 maximum. A $50 deductible applies to Tier 2 and Tier 3 prescription drugs per covered person per year. You can continue to get a 90-day supply through mail order. However, 3 copays still apply. If you or your spouse or domestic partner are enrolled in a city-sponsored medical plan and use tobacco products, a $12.50 premium will be charged per person per pay period. Attending a 2-part Healthy Connections tobacco cessation class will waive the premium for the remainder of the calendar year. The tobacco cessation class schedule is available at austintexas.gov/benefits or on the Healthy Connections page on CitySpace. The city offers 2 flexible spending accounts that allow you to set aside money before taxes. This lowers your taxable income and can result in lower tax deductions from your pay. The Healthcare FSA allows you to set aside the amount you anticipate spending on allowed medical, pharmacy, dental, and vision expenses for the year. You can set aside $5 to $114 per pay period, and you will receive the full amount upfront for the entire year. A debit card will be provided to you to pay for eligible expenses at the time of service. With the Dependent Care FSA, you set aside pre-tax money for eligible dependent care expenses. You can receive reimbursement for daycare expenses for children under age 13 and/or disabled dependents of any age spending at least 8 hours a day in your home. You can set aside $5 up to $208 per pay period. To receive reimbursement, use the bank card provided or complete a claim form. You will use the same debit card for both accounts. Some restrictions to be aware of with flexible spending accounts are: if you choose to enroll in the Consumer-Driven Health Plan or CDHP with HSA, you cannot participate in the Healthcare FSA, but you can participate in the Dependent Care FSA. Flexible spending accounts are use it or lose it, and money not claimed by the deadline is lost. Remember that once you enroll in a flexible spending account, you are committed for the full year unless you have a qualifying life event. Now let's go over some additional benefits. Please refer to your Employee Benefits Guide to get more details about any of these benefits. The city's dental plan is the Blue Care dental plan administered by Blue Cross Blue Shield. Employees and dependents will be able to seek services using in-network and out-of-network dentists. The example below shows how a claim would be paid in-network versus out-of-network. Employees using in-network dentists will see greater savings, which means the $2,000 calendar year maximum will go further towards dental services. Out-of-network services will be paid according to the table of allowance. For more information, call Blue Care Dental at 888-907-7880. To search for an in-network dentist, go to bcbstx.com/COA. Davis Vision is the City of Austin's vision provider, offering you and your dependents coverage for annual exams, glasses, or contacts. Routine eye exams can ensure that you have clear vision and can detect a variety of medical conditions such as diabetes and glaucoma. Davis Vision offers a comprehensive dilated eye examination each year for a $10 copay. They have a large network of providers as well as retail optical chain stores such as VisionWorks, TSO, Walmart, and Sam's Club. The plan covers costs for either a pair of eyeglasses or contact lenses once per calendar year. To help you save for your future, you can enroll in the city's 457B Deferred Compensation Retirement Plan at any time by visiting dcaustin.com. So what is a 457B Deferred Compensation Retirement Plan? A governmental 457B Deferred Compensation Plan is a voluntary retirement savings plan that allows eligible employees to supplement any existing retirement or pension benefits by saving and investing through voluntary salary deferrals. The city's plan is offered through Empower Retirement. If you wish to enroll or change your contribution amount, go to dcaustin.com or contact Empower Retirement at either 866-613-6189 or 512-651-2287. Short-term disability and long-term disability are benefits to supplement your pay if you were not able to work due to an injury, illness, or maternity. Short-term disability is offered at no cost to employees who work 20 or more hours per week and pays 70% of your base weekly salary while you are not able to work due to an off-the-job injury or illness. You are automatically enrolled in this benefit. So why would you want to elect long-term disability in addition to short-term disability? In case your injury or illness extends past 90 days, or if your injury or illness is permanent. Long-term disability will cover 60% of your base monthly pay, and you can continue to receive disability income, even after ending employment with the city, if you continue to be disabled. Long-term disability covers on- and off-the-job injuries or illnesses. To calculate your cost for long-term disability, click the links at austintexas.gov/benefits. Though we never anticipate a long-term illness or injury, having LTD coverage can protect you and your family when the unexpected occurs. Basic life insurance is offered at no cost to full-time employees, and you are automatically enrolled. Your beneficiaries will receive one-time your base annual salary. Supplemental and dependent life are available as optional benefits and are fully paid by the employee. You can purchase life insurance for your spouse, domestic partner, and eligible children. Supplemental life can be purchased in increments of an additional 1 time your annual salary up to 4 times your annual salary. Dependent life insurance is available at increments of $5,000 for children and $10,000 for your spouse, or $10,000 for children and $20,000 for spouse or domestic partner. You can update your beneficiaries at any time during the year. To update your beneficiary, you can use the HR portal if you have access, or complete a beneficiary designation form at your departmental HR. The ARAG Ultimate Advisor Legal Plan offers you and your dependents legal protection coverage. ARAG offers a comprehensive array of legal services, many of which are paid at 100% when you use an in-network attorney. You can work directly with an attorney by phone or office visit to address legal or financial matters. Legal tools and documents are also available online. Keep in mind, the plan is not a license to sue, nor can it be used to take legal action against the City of Austin for any reason. Full-time regular city employees may be eligible for financial assistance of $100 weekly for children enrolled in daycare, up to kindergarten eligible, $100 weekly for disabled dependents up to age 26 enrolled in daycare, and $30 weekly for children ages 4 through 12 enrolled in after-school care. Eligibility is based on family size and gross income. Applications for the program are accepted at any time throughout the year, and you must recertify for the program November and December for the upcoming calendar year. The Youth Camp Scholarship Program is available to all full-time city employees with children ages 4 through 12, regardless of household size or family income. The program provides scholarships of up to $50 a week at participating Parks and Recreation Department, recreation centers during spring and summer breaks. Employees must apply by the established deadlines each year in order to be placed on the PARD eligibility list. Applications are available online at austintexas.gov/benefits. All city employees can receive free assistance researching and locating potential child care providers by visiting dfps.state.tx.us/childcare. Other programs and benefits included at no cost to employees are the Employee Assistance Program, which offers short-term face-to-face or telephone counseling to you and any member living in your household. The commuter programs, which offer free bus and rail passes as well as a subsidy for vanpole participation. The paid parental leave program, which offers FMLA qualified employees up to 240 hours of paid leave for the birth and care of a child or placement of a child for adoption or foster care. The Leave Bank program, which offers employees who become members during open enrollment the ability to access up to 240 hours of paid leave for a qualifying FMLA event throughout the year. And the employee discount page, Perks Connect, which offers employees and their dependents discounts on a variety of products and services. For more information about any of these programs, please refer to your Employee Benefits Guide. The city's wellness program, Healthy Connections, provides resources and incentives to help you know your numbers, get active, eat well, and live healthy. We have a variety of no-cost programs under these 4 pillars of wellness, and employees on a city medical plan can earn up to 16 hours of wellness administrative leave and up to $150 in healthy rewards for participating. Employees engaged in wellness activities have lower healthcare claims costs, fewer ER visits, and higher rates of preventive screenings. The wellness program can also save you and the city money by lowering overall medical claims, which means lower monthly premiums for you and the city. Becoming healthier is a lifestyle change and takes time, planning, and support. Our programs are designed to help with every step of your wellness journey. The first steps to a healthier you are knowing your health numbers and completing the BCBS online health assessment. Employees who complete the Blue Cross online health assessment at bcbstx.com/COA can earn 8 hours of wellness administrative leave once per calendar year. The next step is to make sure you are up to date on your preventive screenings. The city medical plans cover annual physicals and preventive screenings at 100%, and you can earn healthy rewards for eligible screenings. The entire list of eligible Healthy Rewards activities and preventive screenings can be viewed on CitySpace. The PE program can help you get active with free group fitness classes at city worksites. The program offers around 70 classes each quarter. You can also join PE Anytime classes to track your own workouts with supported fitness trackers and apps. Participants can earn up to 8 hours of wellness administrative leave per year. Learning to eat well can be a stress-free experience when you work with our on-site registered dietitian who provides nutritional counseling and health coaching to help you meet your nutrition and weight loss goals. Employees on a city medical plan can also participate in the Naturally Slim weight loss program at no cost. This 10-week program uses the Naturally Slim app to deliver video-based programming designed to help you lose weight while continuing to eat the foods you love. To help you live healthy, we have a diabetes control program that provides diabetes support, education, and no-cost medication and testing supplies. Tobacco users can participate in tobacco cessation classes and receive no-cost cessation medications to help you live tobacco-free. And expectant mothers can complete the Blue Cross Maternity Support Program to receive the support they need throughout their pregnancy and earn $100. Healthy Connections also hosts numerous events throughout the year. This includes city health screenings, health expos, race events, flu shot clinics, mammo mixers, and the City Olympics. We also host health campaigns, quarterly virtual fitness challenges, and monthly wellness webinars. Most activities are eligible for Healthy Rewards. Visit the Healthy Connections page on CitySpace for information about our programs, upcoming events, and wellness incentives. You can ask your department's wellness champion or call 512-974-3284 and ask to speak with a wellness consultant. We hope to see you at our next Healthy Connections event. Thank you for taking the time to review this year's benefits video. We hope you have enjoyed it and that the information has been helpful to you. If you have any questions on any of the benefits that were discussed, please contact the Employee Benefits Division at 512-974-3284. We are available to assist you Monday through Friday from 7:30 a.m. to 5 o'clock p.m.